Hi everyone. It's really good to have this kind of interest again this week. It was quite a number of our colleagues last week, and today it seems it's the same thing. It's an interesting topic. It's one in which we would want our colleagues to be aware of, especially nurses, because personally, and that's just me personally, I feel they're best placed to provide that support for patients when it comes to cancer care reviews. I'll just share my slides. Okay, I'm hoping everyone can see the slides now. Okay, yeah. Great, okay. So my name is Bumi Olajide. I'm the Macmillan GP for Havering. And I will be taking us through the cancer care review today. The objectives today, I'm hoping by the end of this session, we're all aware of the importance of cancer care reviews, how to carry out cancer care reviews, not just cancer care reviews, but a quality cancer care review. And I'll also be touching on how to facilitate an effective personalized care and support. And my colleague, Dr. Matukia, will be taking us through the cancer care review lease for 2020 and what the specifications of the lease are. Okay, so I would like to start with this slide. I know it's quite crowded, but it gives an interesting detail as to what's been happening with cancer. And if you look at the bottom left corner of the slide, where my mouse is, if we look at the 70s, cancer was all about dying. So one has a diagnosis of cancer and it's really, everyone's waiting for when they eventually pass. And what we were seeing then was that we had a 1 in 7 chance of survival beyond 1 year of cancer diagnosis in the 70s. Now that's kind of moved on. And if you look at the 90s, people were surviving beyond a year, actually surviving beyond 2 years. And that's about 2 in 7, just over 2 in 7. An improvement, but still not really great news. And as at the 90s, we had 1.2 million people living with cancer, okay? Come to 2010, you can see the change, that's massive. So you have more than 6 people in 7 surviving cancer beyond a 5-year period. So 6 years post-cancer, you still have 6 in 7 people well and alive. Now, what we are seeing is that increasing number of people with cancer. In the 90s, 1.2 million, 2010, 2 million. And we're envisaging that by 2030, we would have 4 million people in the UK living with cancer. Now, what is really important, if you can see my mouse, is what am I highlighting here? So in the 90s, we had around just over 160,000 people of the 1.2 million dying from cancer. By 2010, that number really hasn't changed. Actually, there was a drop. And we had around 157,000 people dying from cancer. Now, taking note that those living with cancer, the number had increased. So more cancer diagnoses, but death from cancer hasn't really changed. And we're looking at 2030, and the thinking is we will probably be having around 172,000 people die from cancer. But again, if you look at the figure, it's 4 million. So even though the number of patients diagnosed with cancer, that's increasing, what is kind of not increasing is the number of deaths. And there are reasons for this. There's earlier detection and diagnosis of cancer. We've got better treatments now. And we know cancer has moved from being an acute condition to a long-term condition. So we've got people living with and people living beyond cancer, okay? Cancer and primary care. So a typical full-time GP, recent studies from the King's Fund showed that about 8 to 9 new cases per year for a full-time GP. But we know patients who would have presented with symptoms will be more than that. So yes, there'll probably be more than 8 to 9 new cancer cases. Now, we know on a GP's list, there'll be more than that number, but importantly, the GP would have new cases and those already diagnosed with cancer who are living with cancer. And there was a look into that, and the estimate was around 35 patients per 1,000. Now, of these patients on the practice list, over half of them would have been diagnosed more than 5 years ago. This cohort of patients tend to attend more frequently compared to patients of the same age who don't have cancer. Many will have unmet needs, and those needs could be physical, emotional, social, or financial. And what we've seen is that at least 1 in 4 of patients would experience consequences of their cancer or the treatment of their cancer, which would significantly impact on their quality of life. So if I just show again what we are seeing in primary care with regards to what's coexisting with cancer. And if we see again, most of the patients living with cancer would also have hypertension. Okay, so coexisting conditions, hypertension, obesity, mental health issues, kidney disease, diabetes. And a good study from Cancer UK and Macmillan's shown that you would have roughly about 29% of patients diagnosed with cancer having 3 or more other long-term conditions, okay? So that's a huge number. We talked about the consequences of treatment for cancer, but what are the treatments for cancer? There's radiotherapy, chemotherapy, surgery, immunotherapy, which is really gaining ground now, especially with managing certain conditions of the lung and melanomas also. There could be a combination of the above, either 3 combinations or 2 treatments, or in some cases, no treatment at all. And what are the consequences? Gastrointestinal problems are really common. So diarrhea or vomiting or nausea or just pain in the tummy. There's the mental health aspect to a diagnosis of cancer and even treatment with cancer. So mental health problems we do see. Pain. And the pain could be anywhere. It could be pain as a result of treatment, radiotherapy, abdominal pain, additions causing pain. It could be pain due to the cancer itself. A spread to the spine could cause back pain or vertebral pain. The urinary problems, again, either from the cancer or consequence of treatment with cancer. You see that commonly with like prostate cancer. Lymphedema, so swelling at the arm or the legs, again, usually a consequence of treatment, radiotherapy. This diagram, you would see this kind of a picture mainly in patients who've had treatment for breast cancer. And there's just the general tiredness that we all know comes with cancer diagnosis. And also, some patients would report sexual difficulties. One thing we shouldn't forget is the financial impact of cancer. And in 2017, a study came out showing that 4 out of 5 patients diagnosed with cancer, 4 out of 5 are worse off by over an average of 570 per month. Now that's a huge amount of money. So cancer does have significant financial impact on patients. Now, if I touch on kind of the consequences of treatment, again, just breaking it down more, Macmillan kind of looked at this in 2013. And as of 2013, there were 350,000 people who were experiencing sexual difficulties. Now, if I take us back to that earlier slide, the crowded one with the picture, you would remember that by 2010, we had around 2 million living with cancer. So 350,000 of those, that's a considerable amount. About 350,000 also had chronic tiredness, chronic fatigue symptoms. People living with mental health. Now, I'm bringing this to attention because these are the things that would really play a part, things that are really going to be important in us doing or carrying out an effective cancer care review. So we have to consider these complications of either treatment or cancer itself. Okay. So the cancer care review. What we know about the cancer care review is traditionally it's carried out by a GP, and based on QOF, it has to be done 6 months from when the practice is being notified of an individual having a diagnosis of cancer. Okay. But we know there's a consultation actually going on, and that started in July, reviewing cancer care reviews. Now, what that is looking at is, should GPs be doing more or should the practice be doing more? And the consideration as in now is that, how about getting GPs to review these patients twice? First at 3 months from notification, and then subsequently 12 months after. So the first thing, the 3 months review will be looking at the percentage of patients with cancer who were diagnosed within the preceding 12 months. And they've had a discussion about their diagnosis and some support from primary care. And at 12 months, it will be the percentage of patients with cancer who were diagnosed the preceding 24 months, 2 years, and who have had a cancer care review. And this is not just having one, but having one with a structured template. So there's anticipation that this will be what will be happening. We're not sure yet, but watch this space. Something should be published this month. So what a cancer care review should do is it should provide the person living with cancer the opportunity to think through their needs. And in so doing, the patient and the healthcare professional can work towards a plan that best meets these needs. So the needs are identified by the patient, and the patient working with the healthcare professional can draw up a plan that best meets the need. Now, who should be carrying out a cancer care review? When should it be carried out? How should it be carried out? Okay, and who, I think that's changed now, where traditionally it used to be kind of like, yeah, it has to be the GPs. We know better now. And we would say a qualified healthcare professional And I did touch at the beginning on the importance of kind of having our nurses, encouraging our nurses to carry out this review and building the confidence in them to carry out this review. They just have that bond with patients that works, okay? To back this, there's a study in Lanarkshire where they did this project with just about 13 nurses, and they had a quota of about just under 400 patients. And what they did was they kind of sent these patients some pre-review information. So it was mainly for the patient to give the nurses an idea of what their needs were and things like that. The turnout was over 63%, about 250 patients, okay? And what was found was over 85% of the patients rated the quality of the review, or what they took from the review. They rated it above an 8. So that was good scoring. Okay, when I think a cancer care review is looking at the appropriate time, yes, there is the QOF guidelines on that will be coming, when to do it at 3 months, at 1 year, but I think it has to be a time right for the patient. So if you have a patient who is very poorly, kind of probably not in the frame of mind to speak to anyone yet, then there's no need to rush into it. Give the patient the time, a call to say, we're just checking how you're doing. Would like to have a discussion with you. When will be the right time? I think that would help. I've called the patient before, the day after I got a letter, and she was so pleased. I think I got a sock and a card after, but that's it. For different patients, it varies. She was just like, for you to have called me immediately. Some patients wouldn't want that. So when, kind of be led by the patient. How? I think my colleague Vibel will be talking on touching on that. Yes, it has to be structured, and he would touch on that for us. So carrying out an effective cancer care review, okay? First, we need to consider that cancer is now a chronic disease. So your review should be in that light. So you're thinking and carrying out a chronic disease review here, more like you would carry out a review for asthma and COPD. You need a dedicated time slot, no distractions, time for this patient, bearing in mind that a lot of the patients would have emotional needs. So it's a sensitive time for them to talk. These days where we're doing a lot of remote consultation, if your review is going to be via video or telephone, you're making sure that there's no distraction. If it's video, you probably put a do not disturb sign on your door, or you make people aware you're doing a cancer care review. So if it's the nurse doing it, or the a qualified healthcare professional and healthcare assistant, the doctor is not barging in, or if it's the doctor, the receptionist is not barging in. You want to be sure that that time is dedicated for the patient. You can suggest for the patient to be with friends or family. And again, if it's remote, remote consultation, they can have their family with them on video, or on the call, they put it on speaker, okay? Help the patient to prepare, help them prepare, send information for the appointment. I'd recommend the use of a Macmillan Concerns checklist, but a practice can draw up one. I'll be showing you an example of the checklist soon. You need to check with the patient their understanding of their treatments to date. One thing that can guide to that also is secondary care. They do an holistic needs assessment for patients and do a care plan. Also, treatment summaries. I'll be touching on that. We're not getting enough of those coming to us in primary care, but one thing I can say for myself and my colleague, Dr. Matuke, and the rest of the cancer team, we're really working with secondary care to make sure that these treatment summaries are getting to the GPs. So I talked about the checklist. And this is an example, and that's the Macmillan checklist. So you can send this to your patient before their review. And it just allows for a smooth review, really. And they can tick the boxes, what is more, or what's the most important thing to them, or what they would like to take out of the discussion. So tingling in the feet, for example, is it pain or discomfort? Have they got emotional concerns? What information and support they need. For some patients, they just want to know about complementary therapies. Someone's spoken to them about it, and all they want to know about is complementary therapies. So if the practice can draw up one, great. Otherwise, this is something you can use. Okay, so if I carry on with an effective cancer care review, again, use the opportunity to do a medication review for the patient. So you're checking compliance, you're checking side effects of treatment, and please note the compliance is not just compliance with their cancer treatment. Remember the slide I showed earlier, which touched on the fact that patients do have other comorbidities. So compliance, so if the patient's got diabetes and cancer, you're checking compliance with their diabetes medication. It's an opportunity to see what their thoughts are around drug interactions. So some patients might feel, oh, I shouldn't take my asthma medication because it can interfere with my cancer treatment. So it's an opportunity to check on this, okay? Now, choose a template. And again, my colleague will be touching on that. Havering the team's been able to develop a template, and choose a template. It just allows for a structured review. Now, again, please find out what support is available to your patients. It's part of being prepared. And a good place to look at this will be the bmacmillan.org UK. That website is one to look at. There's a lot of information on support for patients, ranging from physical concerns up onto things like insurance. So it's something to look at. I'd like you to use a cancer care review to be a chance for health promotion. So it's the time to talk to your patient about weight loss, exercise, anything to improve their mental health, meditation, anything that works for the patient. But it's an opportunity, a chance to do some health promotion. And the final thing will be important and really, really important for reviews, for studies, for things like that, is you coding appropriately. Please, please, please make sure you code the patient right. So if the patient's having chemotherapy, code them, tick the boxes on the template. So we know what treatment the patients had if we look at the patient's records in future. Talking about support, there is support available. Macmillan, we've talked about. Don't forget about carers support. I know there are colleagues on this webinar from BND and Redbridge. So yes, I've put the Havering Carers Hub because I'm a Havering GP, but yes, I'm sure Redbridge have got their Carers Hub and BND likewise. So please remember the carers for patients also. That's key there. I touch on that every time. It's called the radar key. And that's RADAR. And it's a key that opens quite a lot of toilets in train stations and even some airports. So patients who've got gastrointestinal complications of treatment, fecal urgency or diarrhea, once they need the toilet, they have to go to the toilet. And you could make them aware of things like that. That on its own have stopped a lot of patients carrying on with their life, going out or going somewhere because they're worried what would happen if they go out. What if they need the toilet and they can't get to a toilet? So yeah, the radar key. Okay, so quickly, I'm going to touch on personalized care, okay? What are the aims of personalized care? We know for cancer management, care has to be personalized to our patients. The aims are, so we have a supportive conversation for the patients. It's important that we understand what is important for the individual and be able to offer support as to who can help. We probably won't be able to give the patient all the help they would need, but we should be able to signpost them. We should be able to let them know where they can seek help, okay? Thirdly, please let's identify what support the patient may need so that they can self-manage. So self-management also is something we should think about. And if there's a support that we can offer to the patient so they can self-manage themselves, then please let us offer. Personalized care also helps resolve and reduce anxiety levels for the concerns raised. So for some patients, even being able to talk to the nurse, to the doctor, to the healthcare assistant, it's enough for them. Being able to hear what support they can get, that's enough for some patients. Most importantly, let's support people who live with cancer and help them develop their knowledge, skills, and confidence. Once we do that, the patients are able to manage their own health and well-being better. So just touching on our local hospital, BHR UT, I did mention about the treatment summaries and the holistic needs assessment that is done in secondary care. So a nurse specialist at the hospital, over the years, she's kind of done some kind of almost a survey for patients. And what she finds top of the list, 4 top concerns for patients are worry, so psychological impact of cancer, what's going to happen, things like that. Secondly, the finance and money, which we've identified that it's a big issue. Tiredness, and then fourthly is uncertainty. So not just knowing what's going to happen, okay? The holistic needs assessment is usually being conducted in the hospital using the Macmillan E2 electronic tool. So as I said, it should be all the patients. It's not happening. And COVID is actually even made things worse, but the hospital is looking to kickstart that again. The treatment summaries currently, it's happening with hematology, breast and colorectal teams, and they're hitting around just under 50% of cases. With COVID, that dropped to about 29%, okay? But they're hoping to pick up. Now, the importance of the treatment summaries and how it can help with the cancer care review is that on those treatment summaries, there is the diagnosis and staging for the patient. It talks about what treatment the patient is having and any side effects that is to be expected. It also talks about side effects that could come later on. So late side effects to be watchful of. For example, as clinicians, we know patients can have radiotherapy around the pelvic area, and they've defined for some years, and later on they could develop bowel obstruction, and that's more from adhesions and things like that. So that could be a late presentation. So this treatment summaries touches on those and makes the clinician aware. It also talks on the signs and symptoms which will make a clinician refer back to secondary care, okay? And it also gives information, lets us know if a patient has been assessed for their health and well-being, Okay. Now the hospital they do a newsletter, and I've just kind of tried to screenshot one here, but this is what comes out from BHR UT. And you can see, even when they see the patient, they're already talking about benefits advice. So the patient does have some information. They talk about complementary therapy. There's some information in there, but again, in primary care, we've got our social prescribers who can support also. And we've got those support websites like the Macmillan, Cancer Care UK, that we can get information from. Thank you. Okay, so I'm going to pass those over to my colleague, Dr. Matsukia, to tell us about the LIS. Fiber, over to you.
Bear with me, I'm just setting up. Okay. Hi everyone, thanks for attending this webinar. And my name is Dr. Mathukia. I'm one of the Macmillan GPs for Redbridge. And I'm just going to talk to you today about the LIS, so the specification of the LIS and how to complete the LIS. And I'll touch upon some of the things that Bunmi's mentioned and incorporate that in. And as Comfort said, at the end, if there are any questions, both me and Bunmi are more than happy to answer. So, the background to the LIS, as Bunmi has said, there's clear evidence that if a good and structured cancer care review is performed, that this can be really supportive for the patient. That we know once they finish their treatment in hospital, there are a cohort of patients who tend to feel like they're kind of left and they're in a bit of an abyss where no one's really looking after them. And that's where sometimes the cancer care review can fit in. And what we aim to do with this LIS is to make it so that patients are getting a similar level of quality cancer care review across the board. In 2018, there was a cancer care review LIS, and it's basically building upon the good work from that LIS that we've now, or the CCG have agreed to the new LIS. So I'm now going to just talk to you about how and what's required for the LIS. So in this current LIS, all eligible patients are invited for a 30-minute consultation. It can be between 12 to 18 months post-diagnosis, but actually for the LIS, the cohort of patients will be anyone who has been diagnosed with cancer since 1st of November 2015. The way that we perform this cancer care review can be either via telephone, video consultation, or face-to-face, whichever is most suitable, and obviously taking into account patient choice, but also the recent COVID-19 guidance. So if the patient doesn't feel comfortable coming to practice, then it's absolutely fine to do a telephone or a video consultation. And actually, in this current climate, we would probably encourage it. Your practice manager should have the list of patients who are required to have this cancer care review. All lists are on the computer system. And one additional group of patients that have been included are the ones who have been identified as highest risk in line with what the CMO has said. So, i.e., these will be the ones with cancer who have been told to shield. You will be given this list, hopefully by a practice manager, or you can do searches on your particular computer system to get the list of patients that are included in the LIS, and then over the next 12 months, these are the patients who you can perform the cancer care review on. And then once you have done the cancer care review, one of the important elements is after the cancer care review has been performed, we're going to ask practices to send out a survey to the patients to see how they felt about the cancer care review. Towards the end, I'll show you what the survey includes. So I thought now I'd talk to you about what the actual review looks like. So one thing that we ask or request is that you all fill in the designated cancer care review template. So I've got a screenshot here of the BHR, of the EMIS template. And I'm not sure if you can see my mouse, but when you go to templates, it will be under Cancer Care Review, BHR version 1 KEG. So this is the one that you click on, and this is the one that we're asking all practices to complete. This has incorporated a previous Macmillan template, and it's been devised specifically for our 3 boroughs. And what it does, it gives you a structure that if everyone sticks to, it kind of helps form a good quality cancer care review. And essentially there's prompts throughout the template which helps you to start the conversation with patients. Because as Bunmi has said, a good cancer care review has various aspects where we're looking at the holistic needs of the patient, but essentially it's a conversation with the patient. And this gives you the prompts where you might want to talk about their psychological needs, and it just helps prompts along the way. What I would suggest is before you start performing the cancer care reviews is if after the webinar or at some point you go back to your computer systems and familiarize yourself with the template, so that when you are having the discussion with the patient, you're kind of aware of what's expected to be discussed and what's required. Because one of the important elements of the LIS is that if we can see these tick boxes, every tick box on this first page should be ticked. This is a requirement because this is what will be picked up by KEG, and if payment for the cancer care review is going to be given, it depends on these boxes being ticked. So it's really important that these things are ticked. The actual template is a mixture of drop-down boxes, tick boxes, but also free text. So feel free to free text quite a lot, and I'll show you in the next slide sections where you can free text, but make sure the boxes are ticked. So as I said, if you can see here, there's some free text sections. And as I said, there are various prompts. So you can see psychological impact, health and well-being. These are the sort of areas that we would expect one to talk about in the cancer care review. And these are just reminders that this is what's required to be talked about. And this again is the final bit of the first page, and this is the first page that all the boxes need to be ticked, and it's kind of just got some important information. And as Bunmi touched upon, a good cancer care review should also incorporate lifestyle discussion. And as we are now seeing cancer as more of a long-term condition, it's important that we do talk about all of these elements of that for that patient's care. Incorporated within the template is a really important page. If you see here, I know it's probably a little bit small, but it says additional Macmillan resources. And what this is, again, this is an area I would hope after the webinar you can go back and familiarise yourself with. And it has a lot of resources for yourself, but also places where you can signpost patients. So for patients who have various needs, which are identified via the cancer care review, this is a really good resource. So if you see here, it takes you to a link which will take you to the Macmillan website, but also a support line network number, which is open 8 to 8 or as the hours on the template state. And it's a really, really good resource for yourself, but also for patients. So it's just a reminder that you can signpost patients there. Well, we've touched upon this, but like I said, these are the sort of things that will be discussed in a good cancer care review. It's obviously very individual to the patient and the patient's needs, but these are the common themes that we do tend to talk about. Symptoms, the anxieties, when we talked about the money and financial issues. Also symptoms such as pain and fatigue. Fatigue is a really, really common overlooked symptom for cancer survivors. So for patients who are in this phase, 12 to 18 months post-diagnosis, apologies if you can hear the crying baby, sorry, there's a clinic going on in the background in another room, but again, fatigue is something that does come up, so it's something that is worth asking patients about because it's not something that they might automatically talk to you about, so it's something that's worth talking about. So one of the other elements of the cancer care review is that you might need to do some form of social prescribing, or you might be able to signpost again patients to social prescribing. And there's been lots of evidence showing that this can actually help cancer survivors. So in Redbridge, the way this is done is via our EMIS system. If you can see where I'm moving my mouse, there's a section called Health Unlocked. And what this will do, this will take us to this next page, which if you put coping with cancer, and it will come up with specific resources for your patient. So again, it's all about signposting patients. And one of the important elements of the cancer care review is actually empowering the patient to be able to live with their cancer and actually empowering them to help themselves. And one element of that is actually via social prescribing. These are other sort of strategies you can help patients with to empower themselves. Again, one of the themes of a good cancer care review is giving the patient the tools themselves to help themselves. So, you know, if fatigue is one of their main symptoms, exercise is really important, planning activities, perhaps therapy of some sort, diary of symptoms. These are sort of suggestions you can make to help the patient. I'm just going to briefly now touch upon kind of just resources you can use. So again, as I have said, the Macmillan website has so much information. So once this is over, I would recommend you go to the website, have a look at different resources that will help you to support your patient, but also you can also signpost a patient to go visit, because it just answers a lot of questions for patients. Again, without plugging Macmillan too much, not just because I work for them, but also it's such a fantastic resource. This slide just kind of reiterates the help that Macmillan does give to patients. And Macmillan grants is something that not a lot of people are aware of. But again, because we do know cancer can have quite a big financial impact upon the patient, it's somewhere you can signpost patients where they can get a grant from Macmillan. And I know of a couple of patients who have really been helped in this way, so it's something you can suggest. So just finishing a good cancer care review, you want to, obviously, this is, like I said, it's a discussion with the patient, but you want to ask the patient if they have any questions, signpost them to any services they require. Important for the purpose of the LIS is that you ask them to complete the satisfaction survey, and for yourself, to get payment, make sure the boxes are ticked in the template. This is just once the start of the survey that the patients will be sent, and essentially it's only 6 questions which is sent to the patient via SurveyMonkey. After the presentation, all your practices will be sent the SurveyMonkey link, and you can send this out to patients via AccuRx or whatever texting system you have, and then actually the data will be anonymized, but it will also come back centrally and then analyzed. So it's just a way of us trying to understand whether cancer care reviews done this way have been useful as a practice, as a CCG. So in summary, the importance of the cancer care review has hopefully been highlighted, but the journey stretches way beyond treatment in hospital. And in primary care, we have a real great place to actually help the patients who have stopped their treatment. There's lots of issues that can be brought up in a cancer care review. And as Gunmi has said, the cancer care review can be done by GPs, nurses, healthcare assistants, because it's the discussion. If there are, say, particular symptoms that are identified, say the healthcare assistant identifies symptoms and doesn't feel confident, let's say, in dealing with those symptoms, and you signpost that to a GP for a particular consultation. But the cancer care review itself is a discussion. It's about having that discussion to help the patient, but to empower the patient itself. So you can encourage practical self-help, encourage personal responsibility, and refer to any sort of services as necessary. So that's me talking about the LIS pretty much done. So I think we are now going to go to any questions and answers. Okay, so the first question is from Julia Akinyemi. So the question for everyone is, we currently have healthcare assistants undertaking cancer care reviews via telephone. How do they understand implications of drugs, side effects, and medication management? I do not understand how, if originally GP carries out the review and now a healthcare assistant can. So, okay, I'll answer first, and then I think Bunmi can add upon this. So as we are now in primary care working more and more as a team, and we're viewing cancer as a long-term condition, as I've said, this is more of a discussion. And so, you know, we encourage all healthcare professionals to be able to have this discussion with the patient and say, for example, you might not understand what rituximab or the various drugs that the patients are being treated with. But if there is something that you identify as an issue, that would then be a useful point to signpost for a particular consultation with the GP about that. But the review itself is the discussion, and any needs that are identified from the review can then be dealt with by a GP in a normal telephone consultation, or by a practice nurse, or someone who may be appropriate to deal with that problem. And I don't know if Bunmi wants to add anything to that.
Yeah, I think this is a common question, isn't it? We had it last week also. But yeah, really, as Bible said, it is a discussion. And then you recollect, I talked on that study from Lanarkshire where they had nurses carry out a cancer care review, and the feedback from patients was really good. So the way to look at it is, even as GPs, even for us who've got special interest in cancer, there's some complications or new treatments patients would talk about that we really have no clue about. But it's how you manage your patient. As I said, it's an opportunity also to signpost. So we're not expecting you to know everything. What we're expecting is, with a cancer care review, you're able to listen to that patient and offer support. So if you don't have answers, as an experienced healthcare professional, importantly as a nurse or even a GP, you could go, oh yeah, I understand this of concern to you, and just being honest about it. I don't know much about this treatment, but I'm happy to speak to the GP, or I'm happy to speak to the cancer lead, get information. Or, as I said, there are things like the treatment summaries, which we're really working at to make sure secondary care is getting out, and a lot of the answers will be there. Okay. Secondly, I would just say, as Bible said, we are Macmillan GPs, so please, you hear a lot of Macmillan, don't get bored of it, but there's just so much support there. And on the Macmillan website, actually, it's got, let me see if I can share that. Okay, if I can copy and paste to everyone. Okay, so that link there, I don't know if you can see it now. It talks about the consequences of treatment, okay? And it's training that's being offered by Macmillan, and it's training for all healthcare professionals. They talk about education and awareness, about symptoms or complications of treatment. And they also help develop people, so develop confidence in managing or talking to patients around complications. Okay, so that's something to look at also, but please, it's a discussion. You don't have to be an expert in cancer to carry out a cancer care review. Just make the patient aware that you can signpost them to where they can get support, or you can source that information for them and get back to them. Yeah.
Exactly. Are there any other questions? You can either type it on the chat, or I don't know if we have the ability to put your hand up, or no.
Yeah, I think that should be fine. If if I notice anyone raising their hands, then
okay, so it doesn't look like there's any other questions. So just thank you very much for attending the webinar. Me and Bunmi, so Bunmi's available in Havering if there are any questions about the cancer care review. Myself, I'm available in Redbridge if there are any questions about the cancer care review, and we're more than happy to support practices to perform these good reviews and actually to get through the LIS.
Okay, thank you.
thank you, everyone.
Thank you, Dr. Bunmi and Dr. Matsukia. And